Someone recently asked a question on one of my other videos, what to do about mold exposure that's leading to persistently clogged sinuses, headaches, and fatigue. Um, Good question. Those sound like very unpleasant symptoms to be dealing with, and it'd be great to get rid of those. As per usual, I can't give any medical advice over social media. Anything that I say is for informational purposes only, and please talk to your healthcare provider before making any healthcare decisions for yourself. But just for informational purposes, so when it comes to dealing with mold exposure, generally there are two things to think about. One is there ongoing mold exposure? And if so, can that be remediated, or does one have to, move to a different workplace, home, what have you? But like, does one need to remove oneself from the mold exposure? Or barring that being an option, which unfortunately is not always an option for folks, then can enough damage control be done with the right types of strong air purifiers and maybe diffusing things like essential oils or other things into the environment to try to neutralize the mold toxins as much as possible. So that environmental component, or that like ongoing exposure component. And then the other component is what kind of internal treatment needs to be done, if anything. If mold has colonized the sinuses, if in folks who are susceptible to that, or if there's been long enough exposure where that's a possibility, then the sinuses, in my experience, need to be fumigated, essentially. We use essential oil nasal sprays or nebulizers with essential oils, sometimes other substances, but almost always essential oils, to help facilitate that. And I have other past videos about that, so check those out if you're so inclined, or if you want more information about that, I'm happy to post another video about that. So if there's been that sinus colonization, sinuses need to be treated. And then if there's been sinus colonization or not, another important component to treatment is making sure that any mycotoxins that are in the body due to ongoing exposure from the environment or from generation of mycotoxins / mold toxins coming from the mold in the sinuses, that those mycotoxins need to be neutralized and detoxified as efficiently as possible. So that typically involves using an intestinal binding agent like activated charcoal or bentonite clay or chlorella, or if one has access to it, prescription medications like cholestyramine or Welchol, and then also making sure that the liver detox pathways are working properly, so making sure there's enough support for phase 1 and phase 2 detox pathways within the liver, which largely revolve around B vitamins, certain minerals, antioxidants like glutathione. Want to make sure that the phase 2.5 detox pathways are working well, so making sure there's good bile flow to actually flush those processed toxins from the liver into the small intestine. And then you want to make sure there's proper elimination happening as well. So you have the binder in the intestinal tract, but also need to make sure the bowels are moving well, the bladder's moving, or the kidneys are processing, and the bladder excreting urine efficiently, and then maybe facilitating additional detox through, say, saunas to help flush things out through the skin. So those are all the things to take into account when it comes to dealing with a mold toxicity issue. Now, it's a lot of stuff, and not every case needs to work on all of those steps. In my clinical experience, at least, I've had some patients where they just use the nasal spray and they're good to go, or they just go on a binder and that makes all the difference, or they just move out of the moldy environment or have it remediated and everything's fine. And then some patients need to do all of the above and then some, because unfortunately there can be coexisting things along with the mold. A lot of my patients with mold toxicity have heavy metal issues or methylation cycle issues or chronic infections or digestive tract issues or various other things. So it can get really complicated sometimes. So I hope that information is useful. If you have any further questions, if you or anyone else, you, the one who asked the question, or if anybody else has any questions about this topic or anything else, just post in the comment section below and I'll do my best to answer as soon as I can.